Next module, compliance auditing process. Compliance auditing is a systematic evaluation of an organization's adherence to regulatory requirements, policies, and best practices. In the health information technology sector, compliance auditing is critical for ensuring that healthcare organizations meet applicable laws such as HIPAA and HITECH and maintain the privacy and security of patient information. This module provides a detailed explanation of the compliance auditing process, including its importance, key components, methodologies, and best practices in the context of health IT. Next, importance of compliance auditing in health IT. Compliance auditing serves several vital purposes within the healthcare sector. These include ensuring regulatory compliance, identifying vulnerabilities, enhancing data security, continuous improvement, and building trust. Firstly, ensuring regulatory compliance. Regular audits help organizations confirm adherence to federal and state regulations, reducing the risk of legal issues, financial penalties, and reputational damage. Next, identifying vulnerabilities. Audits can uncover weaknesses in security controls, data handling practices, and operational processes, allowing organizations to implement corrective measures before any incident occurs. Next, enhancing data security. By assessing the effectiveness of security measures and protocols, audits help strengthen the protection of sensitive patient data, minimizing the risk of data breaches and unauthorized access. Next, continuous improvement. Compliance audits provide organizations with insights into areas for improvement. The feedback obtained can guide the development of policies and training programs, ultimately fostering a culture of security and compliance. Next, building trust. Demonstrating a commitment to compliance through regular audits reassures stakeholders such as patients, staff, regulatory bodies, and partners that the organization prioritizes data privacy and security. Next, key components of compliance auditing. The compliance auditing process involves several foundational components that ensure a thorough examination of policies, procedures, and practices. These include audit planning, risk assessment, document review, interviews and surveys, technical assessment, control testing, finding and recommendations. Firstly, audit planning. The first step involves defining the scope, objectives, and timeline of the audit. This includes identifying which areas, departments, and regulations will be audited, as well as establishing key performance indicators, also referred to as KPIs, to measure compliance. Next, risk assessment. Prior to conducting the audit, a risk assessment helps identify potential vulnerabilities and areas of concern within the organization. This assessment informs the audit plan and focuses efforts on the most critical areas. Next, documentation review. Analyzing relevant documentation, including policies, procedures, training materials, access logs, and previous audit findings, is essential for evaluating existing compliance measures. Next, interviews and surveys. Conducting interviews or surveys with staff can provide insights into their understanding of compliance policies and procedures, as well as their adherence to these guidelines in day to day operations. Next, technical assessments. In a health IT context, auditing health IT systems and infrastructures is crucial. This includes evaluating security protocols, data encryption measures, access controls, and overall system functionality. Next, control testing. Auditors assess internal controls by testing different aspects of the processes to determine whether they function as intended. This can involve examining compliance with access controls, data handling processes, and reporting mechanisms. Next, findings and recommendations. Upon completion of the audit, auditors compile findings that document compliance levels, identified gaps, and areas for improvement. They provide actionable recommendations to enhance compliance practices. Next, methodologies for conducting audits. Certain methodologies are commonly employed to conduct compliance audits in health IT, including internal audits, external audits, and continuous auditing. Firstly, internal audits. Conducting audits internally allows organizations to evaluate their own compliance without external involvement. Internal audits focus on self assessment, identifying areas for improvement, and ensuring that staff understand compliance practices. Next, the external audits. Hiring an independent external auditor can provide an objective assessment of compliance. External audits help organizations gain insights and recommendations from professionals with specialized expertise in regulatory requirements. Next, continuous auditing. This approach involves regularly monitoring compliance on an ongoing basis rather than relying solely on periodic audits. Continuous auditing leverages technology to track compliance metrics in real time, allowing for proactive identification and resolution of issues. Next, best practices for effective compliance auditing. To ensure the effectiveness of compliance audits in health IT, organizations can adapt the following best practices. These include establishing a culture of compliance, using audit checklists, documenting everything, regular training, and follow up on recommendations. Firstly, establishing a culture of compliance. Foster an organizational culture that prioritizes compliance and supports staff in understanding their roles in maintaining data privacy and security. Encourage staff to report compliance concerns without fear of retribution. Next, use audit checklists. Developing comprehensive audit checklists can help ensure that all essential areas of compliance are assessed. Checklists provide a systematic approach and streamline the auditing process. Next, document everything. Maintaining thorough documentation throughout the audit process, including planning, execution, findings, and corrective actions, ensures transparency, accountability, and facilitates ongoing compliance management. Next, regular training. Offering ongoing training and educational resources related to compliance helps staff stay informed about policies and regulations. Training sessions should address updates in regulations and provide practical guidance on compliance practices. Next, follow up on recommendations. After audits, organizations should implement the recommended corrective actions and conduct follow up audits to ensure issues have been resolved effectively. Regular follow ups demonstrate the organization's commitment to continuous improvement and maintaining a high standard of compliance. Next, learning from audit results. After completing compliance audits, organizations should conduct a thorough analysis of the results. These include action plans, engaging stakeholders, and creating a feedback loop. Firstly, action plans. Developing clear action plans based on the findings of the audits. This includes assigning responsibilities for addressing identified issues, setting timelines for implementation, and defining specific outcomes to be achieved. Next, engaging stakeholders. Involving relevant stakeholders such as leadership, IT staff, HR, and compliance officers in discussions about audit results. Their input is valuable in prioritizing changes and refining processes based on the audit findings. Next, creating a feedback loop. Establishing an ongoing feedback mechanism where employees can provide insights on the changes implemented as a result of the audit. This encourages participation in compliance efforts and helps identify further areas for improvement. Next, regulatory updates and compliance maintenance. Regulatory requirements can change, necessitating that organizations remain vigilant and adaptive. This includes staying informed, reassessment of compliance policies, and conducting regular training. Firstly, staying informed. Regularly monitor updates to laws and regulations, such as modifications to HIPAA and high tech, as well as new guidance and standards issued by relevant authorities. Subscribing to regulatory alerts and participating in professional associations can help keep organizations informed. Next, reassessment of compliance policies. Review and update compliance policies and procedures to align with new regulations or best practices. Involving legal and compliance experts during this process can provide an added layer of assurance. Next, conducting regular training. With every regulatory update, it is essential to conduct training sessions for staff to understand the changes and how they impact existing compliance practices. Continued education fosters an environment of compliance awareness. Next, technology and automation in compliance auditing. Leveraging technology can enhance the effectiveness and efficiency of compliance auditing process. These include audit management software, data analytics, and automated compliance monitoring. Firstly, audit management software. Utilizing audit management software can streamline the audit process by facilitating documentation, tracking findings, reporting, and ensuring that necessary actions are implemented in a timely manner. Next, data analytics. Implementing data analytics tools allows for the proactive identification of compliance issues. For example, analyzing access logs can help pinpoint unauthorized access attempts or unusual patterns indicating potential security breaches. Next, automated compliance monitoring. Some organizations deploy automated systems to continuously monitor compliance with regulations. These systems can trigger alerts when non compliance indicators arise, enabling real time responses. Next, the future of compliance auditing in health IT. As the healthcare landscape continues to evolve, the approach to compliance auditing will also change. Key trends likely to shape the future include greater focus on cybersecurity, integration with quality metrics, and collaboration with external auditors. Firstly, greater focus on cybersecurity. With increasing cyber threats in healthcare, compliance auditing will likely place greater emphasis on assessing cybersecurity measures and protocols to protect patient information. Next, integration with quality metrics. Compliance audits may increasingly be integrated with quality of care metrics, allowing organizations to assess how compliance affects clinical outcomes and patient satisfaction. Next, collaboration with external auditors. The role of external auditors is expected to expand, with healthcare organizations seeking partnerships with these experts to gain insights into best practices and regulatory changes. In conclusion, compliance auditing processes are integral to the success of health IT initiatives and the protection of sensitive patient information. By implementing robust auditing practices, healthcare organizations can ensure adherence to laws and regulations, identify potential vulnerabilities, and continuously improve their compliance efforts. Through systematic planning, thorough execution, and comprehensive follow up, organizations can build a culture of compliance that enhances operational efficiency, mitigates risks, and ultimately contributes to better patient care. As healthcare regulations evolve, ongoing education, Technology integration and proactive stakeholder engagement will be critical for maintaining robust compliance auditing practices within health IT. By identifying and applying effective audit processes, health IT professionals can play a key role in promoting patient trust, safeguarding health data, and ensuring the ongoing success of healthcare organizations. Thank you.